This video is on part 2, the clinical application of the Miller-McEntire Periodontal Prognostic Index. Before looking at this video, you should have spent time looking at the part 1 video, which is on the background and development of the concept. The reason I say that, in this simplified scoring system that will be presented on this tape, the hygienist, the dental assistant, and any other staff have an integral part to play, and they need to have an understanding of how the concept was developed. In case patients ask questions, they would need to be able to answer those. You will notice on this slide we have the first 3 of the 7 factors listed. The reason these are separated at this point, these 3 factors can be scored from the health history before the dentist even comes into the room. Now, let's talk about patient number 1, who is a 42-year-old male who smokes a pack of cigarettes a day and is not a diabetic. One of the earlier videos that I would suggest that you look at is one on the treatment-focused diagnosis. This is a real breakthrough in teaching, especially dental students, for it enables them to look and get a diagnosis and see exactly where treatment needs to be rendered. And in this particular case, the TFD would be moderate to severe localized periodontitis in the molar areas, again pointing out exactly where the major treatment needs to be done. We now need to look at the other 4 factors which you see listed above. The first 3 factors taken from the health questionnaire, age 1, smoking 4, diabetes 1, has already been recorded. The next thing we're going to score is the molar type. And we know that mandibular molars have a much better prognosis than maxillary molars, and that the maxillary first molar has a better prognosis than the maxillary second molar. So therefore, we're going to score the maxillary first molar and score that a 1. The probing depth on this case, we're going to have probing depths between 7 and 8 millimeters. So we'll take the higher of that and say the probing depth score is a 2. There are 2 furcations involved in this case. First, the mesial-palatal and the distal-palatal. And we're concerned about the mobility because in doing the occlusal exam, we find that this tooth has a centric prematurity on it as well as a balancing interference. And by including occlusal therapy in our treatment plan, we will have a marked impact on prognosis. You will note that the total score is a 12. Exactly what does that mean? We're interested in treating teeth that have better than a 50-50 chance of surviving, and the score of 12 means that this tooth does not, or these teeth do not meet that criteria. And because of that, many dentists would go ahead and suggest removal of these teeth rather than treatment. Now let's see what we can accomplish with a treatment. First of all, the age is not going to change, but in this case, the patient is going to stop smoking, so we can take a 4 off. They're not going to be diabetic, and the molar type will remain the same, and the probing depth certainly could be reduced, and let's say we get that down to a 5 millimeter probing depth generally. There are 2 furcations involved, and that will remain, but by the occlusal therapy and reducing inflammation, certainly the mobility would be reduced, and now we have a score of a 6. So we go to the scoring form on the right, and we see with a 6 that now the patient has a 90% chance of keeping the tooth for 15 years if they will follow the keys to success, which we will mention in a moment. And I think you can now realize from a hopeless situation to giving the patient this much encouragement is going to have a very positive impact on patients accepting treatment and continuing through treatment. On patient number 1, we mentioned that the first 3 factors, age, smoking, and diabetes, could be scored from the health questionnaire. Now let's take a little different twist on that. And let's talk about patient 2 and the significant findings that we found on the health questionnaire. First of all, the patient indicated that the mother and 3 aunts are diabetic. Does that raise a red flag? Yes. Secondly, the patient is significantly overweight. The 2 of those would indicate that there's a possibility that the patient is diabetic, but interestingly enough, the patient denies being diabetic. So what will we do? I would suggest that we do an office A1C to see exactly what the score is, so therefore the dental assistant would only score age and smoking, because the patient is smoking 2 packs of cigarettes a day. Then I would suggest that the patient be, as I pointed out earlier, have an A1C done in the office because they say they're non-diabetic, and by doing the A1C now that we mentioned earlier, the score is an 8.7, which indicates that the patient is probably diabetic. But remember, the diagnosis of diabetes mellitus is not a dental diagnosis, and because this impacts so many aspects of the patient's life, including what type of jobs they may qualify for, we do not want to make the diagnosis. If this score had been 5.7, then we would stop there and go ahead and treat. But since it's an 8.7 at the initial exam, we're going to use a 3 and then see exactly what the patient is told by the physician. The treatment-focused diagnosis is a generalized gingivitis. There's no attachment loss, and although the tissues are highly inflamed, bleed easily on probing, we are not dealing with any attachment loss. So now we have scored the first 3 scores based on what we decided to do with the A1C now. Molar type is a 1. Probing depth is not significant. There's nothing over a 5, although the tissues do bleed very readily. Furcation involvement, certainly not. We don't have furcation involvement when we don't have attachment loss. And the teeth are significantly mobile because the patient has an elevated blood sugar, and elevated or exaggerated mobility is one of the clinical findings that we find in the diabetic patient. So this patient scores a 10, although they have a more or less minor periodontal treatment-focused diagnosis of a gingivitis. And what does the 10 tell us? The patient has a 67% chance of keeping the teeth for 15 years with no treatment. But let's go ahead and treat the patient. We're going to treat the patient with non-surgical treatment, just scaling, good home care, not doing any root planing because you don't do root planing in a case of gingivitis. The patient stops smoking, and they get the A1C down to about a 6.1. Molar type remains the same. The probing depth was not there before. It's not there now. Furcation involvement, not there now. But by controlling the inflammatory response as well as controlling the diabetes, we're going to get a much healthier tissue, and the mobility is going to decrease. So we down to a 3, and what does a 3 tell us? A 96% chance of keeping the teeth for 15 years. I think you can see how motivational this can be when the patient understands what is the cause of the problem. Yes, bacteria are the primary cause, but when we add the impact of diabetes and smoking, we can see what a negative impact we have, and this would be very motivational in having the patient to stop smoking and control their blood sugar. Now look at patient number 3. And certainly you will be seeing with an aging population more patients like this. We're dealing with a 75-year-old male who is a non-smoker. He's a diabetic but does not know his A1C score, and we suggested that we do an A1C in the office as we've talked about, but the patient declined. So what do? You assign a 2 for diabetes. His treatment-focused diagnosis is a moderate to severe generalized periodontitis. And here we look at the various things. Remember, we score age, smoking, and diabetes, and I would suggest that the patient fill these scores in before you ever see the patient. We're dealing with tooth number 14, and remember, number 14 provide 60% of the chewing function, given that the premolars each provide 10% and number 15, or the second molar, provides only 20%. So this is a tooth I would think you would want to save. The molar type is a 1, the probing depth is a 2, which means we got significant probing depths. We got probing depths in there of 7, 8 millimeters, maybe a 10 millimeter pocket, which is pretty severe. We understand that. But on this tooth, there's only one furcation involvement. And let me emphasize again, that is a furcation that is involved. That does not mean it's a class 1 or a class 2 or a class 3. And it could very possibly be a class 1 furcation. And because we've got some occlusal trauma on the tooth, with a non-working interference and the centric prematurity on that tooth, we are a little concerned about the mobility. But look at the overall score, an 8. That's not a particularly bad score. So the patient has an 81% chance of keeping the tooth for 15 years. Let's remember, we're giving the patient the potential if they do the things that we are going to ask them to do, and we'll talk in a moment about the keys to success. Now, we go ahead and treat the patient, and with this particular case, perhaps you don't want to do surgery, perhaps you want to use the laser, which is becoming increasingly popular, and I think it's very feasible that an 8 or 9 millimeter pocket could be reduced down to a 5 or 7, which could be very significant in the improvement of oral health. And then using the simple, least expensive mouthwash in a water pick to flush down into that area could mean that inflammation could be very well controlled, even though we've got a compromised situation. Smoking remains the same. The patient ultimately had an A1C test, and that came back a 6.7, so that comes down to a 1. Molar type remains the same, and we were able to reduce the probing depth down to about the 6 millimeter range. Certainly the one furcation remains, and because of reduced inflammation and removing the non-working contact as well as eccentric prematurity on that tooth, we now are not concerned about the mobility, and we're down to a 5. Now remember, on your score sheet, what we're striving for is to keep the score less than 5. But to get it down to a 5 on a 75-year-old with a generalized periodontitis, ladies and gentlemen, that ain't a bad deal. And we've gone from an 81% chance up to a 93% chance of keeping the teeth for 15 years. But you're thinking, I can't promise the patient that. Well, remember, you're not promising the patient that. You're giving him the opportunity, or her the opportunity, to achieve this result if they will follow the keys to success. Now let's talk about the objectives of this clinical application. The main thing it's designed for is to motivate the patient to accept and complete treatment. That is, to increase your case acceptance. Number 2, to create patient referrals. I think this is the best opportunity we've had in periodontics to create patient referrals since I began practicing 50 years ago. It also simplifies the scoring so it requires no time from the dentist. Number 3, you have to train the staff to do the scoring if you want to take no time from the dentist. The importance of smoking cessation. First of all, scoring has been found to be a very powerful motivation factor in convincing patients to stop smoking. And I think we're obligated to let the patient know this particular fact. Patients who smoke with periodontal disease have an increased chance of losing their teeth to periodontal disease by 246%. I think we're very remiss if we do not share that information with patients. Now, later on in this video will be about a 2 to 3 minute video on smoking cessation as I presented it. And I think taking 2 or 3 minutes, even if you don't want to do it, to have your staff do it, because this is such an important finding. But we're not in the business of doing smoking counseling. Do not set a fee for this. So even though we spend a brief time doing it, we need to refer them for deeper counseling, by calling 1-800-QUIT-NOW, which they can get this counseling 7 days a week, 24 hours a day, 365 days a year. But what are the advantages of scoring? First of all, this is not a promise of success, but a guideline that allows the patient to succeed. Number two, you will note the patient assumes 100% of the responsibility for success. What does this do? That means the dentist assumes no responsibility for the outcome. And here are our keys to success. Remember what I said earlier. Oral hygiene instruction, control of bacterial plaque obviously is the backbone of all periodontal treatment. So the patient has to brush and floss and clean their tongue on a daily basis. And there's a video on that I'll show you in a minute how to link to. They've got to complete the treatment. If you don't complete the treatment, there's no chance of success. They got to get on a maintenance schedule, and they got to follow what we say. If they don't follow the maintenance schedule and the case fails, that's totally the failure of the patient. Yes, we want them to stop smoking or at least cut back, and on our diabetic patients, we want to encourage them to control their blood sugar. Now here are the two videos that I mentioned earlier on cleaning the tongue. The first one by Dr. Robert Rippich talks about the importance of doing that, and the other one, the least expensive, most effective mouthwash, is a real key to controlling plaque as well as keeping deeper probing depths happy. Conclusions. Scoring markedly motivates patients to accept treatment. It's fast, simple, and easy to do, and it increases referrals from patients because they see what a positive impact that periodontal treatment can have, and by sharing this information with family and friends, this should increase referrals to your practice. It proves conclusively that many teeth we initially thought were hopeless are in fact treatable. It proves that teeth with furcation involvement can have a good long-term prognosis if you are willing to treat these teeth with furcation involvements. But here's something to think about. We as dentists have a moral and ethical responsibility to provide information that will allow the patient to keep their teeth. If we do not fulfill this obligation, we open ourselves up to potential lawsuits. Using the index fulfills our moral and ethical responsibility and will protect you from lawsuits.